resources, instead of being poured into healthcare, right? We know that Black communities are twice as likely to not have a hospital within their community. We know that Black communities are even if you look at drugstores, CVS pharmacies, Kroger's, or Walgreens, 70% of all those drugstores are in predominantly white communities, not in Black communities. We have our hospital deserts, we have pharmacy deserts.
If you believe we can change the narrative, if you believe we can change our communities, if you believe we can change the outcomes, then we can change the world. I'm Rob Richardson. Welcome to Disruption Now.
Welcome to Disruption Now. I'm your host and moderator, Rob Richardson. With me is a friend of mine. We sometimes go together on Roland Martin Unfiltered. Dr. Ebony Jade Hilton, I should say, an anesthesiologist. And she's also a social advocate and is using her position to help people and to lower the disparities. Dr. Hilton, how are you?
Yeah, I'm doing great. How are you?
Hey, I'm hanging in there. You know, we're seeing a light at the end of the tunnel when it comes to this pandemic. Thank God, right? I mean, at least I can tell you that I'm relieved. I'm ready to get out and go travel. And so I think I want to really start with the pandemic, where we're at now, what you've learned in this moment, because I think there's a lot that's happened. Obviously, the last year was a crazy year. Politically, I believe it ended well. And I'm not just talking about for Democrats. I'm talking about for people that believe in sanity and science. But we still, I think the pandemic and the protests coming together really, I think, highlighted for people things that we already knew about the disparities in health. Like, what do you think we can do at this moment to really change the trajectory of these disparities that are going on in the healthcare industry specifically?
Right. Well, it's one of these things. I think 2020, there was this intersection of pandemic and protest. We saw how, if you truly dive into the data, you will see that the same risk factors that are present that leads to the reasons why Black men are more likely to die at the hands of police brutality are the same exact risk factors that lead to Black men losing 3 years of life expectancy in 6 months related to COVID-19. It's the same thing. And so one of the
interesting. Things, tell me how those are the same thing. Like how are you bringing that together?
Right. Because it's if you look at where police brutality, it all kind of stems from what's happening within the communities, right? Over policing of communities, resources, instead of being poured into healthcare, right? We know that Black communities are twice as likely to not have a hospital within their community. We know that Black communities are even if you look at drugstores, CVS pharmacies, Kroger's, or Walgreens, 70% of all those drugstores are in predominantly white communities, not in Black communities. We have our hospital deserts, we have pharmacy deserts, because when the state allocates funds, instead of it putting it into healthcare centers for the Black and brown communities, we instead have over policing of our communities, right? And we know over policing leads to more people being pulled over, leads to, unfortunately, Black men being 3 times more likely to be killed by police officers, regardless if they're armed or unarmed. It leads to 1 in every 1,000 Black men can expect to die from police brutality within their lifetime. Those risk factors of literally what is your zip code can help to determine whether or not you're going to have this contact and this interactions with police departments, unfortunately. But the same thing happens on the medical side. Your zip code is a more important determinant of health than your genetic code. It's not that Black people are have weaker DNA. That's not what's happening.
No, we wouldn't have made it this far if that was true.
Oh, incredibly. I mean, literally, if you look at West Africans that come to the United States of America, their health outcomes are actually on par or better than white Americans that have always lived here. It's their children's children that start to have the racial health disparities that we see as far as African Americans. So it's not our genetic makeup. It literally is things like Flint, Michigan with water supply, right? If you give me water that's laced with lead, then yes, I'm going to have a higher incidence of cancer formation, right?
And I think when you talk about this, Dr. Jade, a lot of the conversation with people they think a Democrat, Republican, which is not that simple. Or they think, okay, well, what you're saying is we need to spend more money on resources and doing things. And maybe, but that's not necessarily true. When people talk about reimagining policing, you think about all these communities. It was, I think Malcolm X talked about it. Like there is no community, there are no communities that have more policing than Black communities, but somehow the communities still aren't safe a lot of times. So what's the issue here? Like just because there's a larger presence of policing or you spend more money on policing doesn't mean the community is more safe. And you really have to look at how much resources. I can tell you almost in every community, the resource that's never adjusted, never looked at, never cut is the police department. It's like untouchable. And that's usually the biggest line item in every single city. But yet we have all these other disparities. So it's really, when you talk about, we have to look at these things in a comprehensive manner. And what COVID-19 did is I think it was the great exposure, because these disparities were there. Right. It probably exacerbated them, but it also exposed them in a way that people really got to see the disparities in ways that they didn't.
Right. I mean, not only were they there, Black people, we had higher death rates for 9 of the 15 leading causes of death before COVID. Right. We died at higher rates at younger ages. We not only had higher death rates for maternal mortality, so women in the birthing process and up to a year after their baby is born, dying at 3 to 4 times the rate of white women. Not only were we bearing our children at 2 times the rate before their first birthday than white babies, we had higher death rates in pretty much all the cancer types you can think of: lung cancer, colon cancer, breast cancer, prostate cancer. We saw with Black Panthers, right? We all were like, wait, where is this coming from? Because Black people, we don't talk about it often. There's not really any mention. When we're talking about breast cancer awareness, for instance, typically we see a white woman's face, but Black women have higher death rates in every single state of the United States of America related to breast cancer. And we die at younger ages with more aggressive forms. We die at younger ages from cardiovascular disease, heart failure, strokes. We die at higher rates related to it. So this is not anything new. COVID-19, the only reason why I got so much attention was that the deaths were happening so fast that you can't ignore it, right? But these disparities as far as racial health outcomes have been the same since literally the founding of America, and even before that, since we got here, we were brought here. So, and when we're talking about police and the money that's associated with policing, what we have to remember is that whenever, especially with the Black and brown community, when we associate policing with a potential threat to our bodies, when you see those blue lights hit, or you see a police officer circling through your neighborhood, we have to remember that mental health is physical health. So when you see that police car and your heart rate starts to beat really fast because you're afraid, your breathing pattern starts to change, that's because a hormone in your body made your end organs meaning your heart and your lungs, act differently. And what are those hormones? Well, we call that your fight or flight system. So the same thing, if a tiger was chasing you and you needed to run and get away, that's the same response that you get when you see a gun pointed to your face. That's the same response that you get when someone says that you come from, can I cuss on the stage? You
can cuss as much as you want.
All right, good. If someone says you come from shithole countries, the response, the anger, that is also the same system of this fight or flight system. So we call that your hypothalamus talks to your pituitary gland, which is all in your brain, talks to the adrenal glands, which sit right above your kidneys. And those adrenal glands release hormones called your cortisol, your glucagon, and your catecholamines. Catecholamines are adrenaline, right? For lack of better words. And so those hormones literally change the way your heart functions. So it causes your heart to beat faster. It causes your blood vessels to constrict, which means high blood pressure. It causes your kidneys. These hormones literally cause your kidneys to retain sodium and water, which increases your overall blood volume, which leads and can lead to heart failure. It causes your liver to process sugars differently, or literally to create sugars and to mobilize fat and proteins. It also causes you to literally be immunosuppressed. Yes, immunosuppression. And is that one of the reasons why we do see the development of cancers for Black people? It also causes your pancreas to have decreased insulin secretion and leads to insulin resistance. So this fight or flight, this constantly being angry, this constantly being unsafe as a racial minority in a majority country causes these fluctuations and chronically elevated stress hormones, and it's been linked to diabetes, hypertension, obesity, to infant and maternal mortality, to cancer progression. You name it, is all tied to each other. It's not just, oh, I feel bad. Yeah. It's a consequence to it.
And then you add COVID on top of that, which just accelerates these disparities and really makes things worse because you're introducing a new agent that people aren't used to. And now they have to deal with that too. So therein is it goes back to what you've talked about a lot, and I want to get to. You said the narrative would be that Black people are resistant to taking the vaccine, and that's the reason why a lot of Black folks aren't vaccinated. But you said there's a different narrative to that.
Right. Very early on, December, I received my first vaccination December 15th and the second January. I'm
getting mine this Saturday. Hallelujah. Thank you, Jesus. Go ahead.
But it was one of those things, in January, December, January, and February, I made statements that even if a Black person wanted to get vaccinated, they couldn't throw money to get it. Literally, the way the policies were written, Black people were largely left out of the descriptors of who qualified to be vaccinated. Even though we knew racial health disparities existed, even though we knew that Black people were 3 times more likely to be hospitalized at that point and twice as likely to die from COVID-19, more likely to be infected with COVID-19. But when they came up with the policies of the phase 1A groupings, they said, well, we're going to vaccinate healthcare workers first and people who belong to nursing homes. Well, if you look at the demographic of people who are actually healthcare workers, 60% of healthcare workers are white, 16% of healthcare workers are Black. If you look at nursing home residents, it costs money to place your family members into a nursing home, of which there's a wealth gap in America that we can talk about the systemic racism that played into that. But with nursing home residents, 78% of nursing home residents are white. Even when you go down to the phase 1B, they then said, okay, now we're going to open it up to 75 and older. Well, unfortunately, the life expectancy for Black people before COVID was only 75. So when you say and older, we're not in that group. In fact, right. If you look at the US population for 65 and older, right? Literally 65 and older, 77% are white.
Wow.
Only 9% of 65 and older are Black. We don't.
Wait, say that again. Only 9% of 65 and older are Black?
We don't.
I didn't know that.
See that age group. It's a major problem, again, because of all the things I talked about earlier. Black people having higher death rates before COVID. From all the common things that kill people, we're dying at younger ages from those. And even with the phase 1B, so they initially said 75 and older, then they dropped it down to 65 and older again, which is still largely excluded, or at least heavily populated by white people, let's just say it that way. But they also said then we're going to do employment. So we're going to say essential workers, teachers, police officers, firemen, grocery store workers, and transportation agents. But when we look at even employment, what we know is that we had a health crisis, but also a financial devastation during 2020, where millions of people lost their jobs, right? And in fact, by April, there was a study out of New York Times published that by April, less than 50% of all Black adults actually had a job. So this,
wow.
Yeah, so this phase rollout literally tied the priority of who would be vaccinated on age, of which Black people die at younger ages, and on employment, of which Black people are more likely to not have a job. In a disease process where Black people were more likely to die. So, yeah. So this wow. race neutral policy, if you truly look at the numbers, ends up being pro-white. So we shouldn't be surprised at the fact that at this point, 70% of all persons that are fully vaccinated are white Americans.
Well, that's a great point you bring up there. When we look at a lot of policies that report to be race neutral,
mm-hmm.
when you're not intentional about race, you end up being detrimental to Black and brown people because by default, you have a system that's built against them. And unless you're intentional about being inclusive, looking at the disparities, you will get the results you talked about. So you mentioned that President Biden should have a Secretary of Equity. So walk me through what you think about that. And I just love to get your feelings, because I like the idea, but then I have some concerns about it, but I want to hear what you think about it.
Right. Yeah, because I mean, like this policy is not race neutral. It's actually pro-white. And I just want to put that out there, just based on the definition of the criteria by which they use. It selects itself for whiteness. Now, with that being said, we have my consulting firm, Goodstock Consulting. We wrote the Congressional Black Caucus before vaccines rolled out. But in thinking of the totality of what happened in 2020, again, with this intersection of pandemic and protest, what we know, and again, as we just stated, the same risk factors that make Black people more likely to have, insults from the police are the same risk factors that lead us to dying at higher rates from COVID-19, are the same risk factors that are associated with our children being expelled from school more often, are the same risk factors that lead to Black and brown people being less likely to own our houses, right?
Right.
It's the same risk factors for all of these things. And so our thought was, instead of us for generations, we've reported these same exact disparities. Nothing has changed, right? We've been dying at higher rates for generations. We've been poor and having this wealth gap for generations. We've been not able to afford to buy our own homes for generations. Instead of reporting the same disparities, we need to have some accountability tied to it, because we are taxpayers. So if I am giving my money to the government, we should have an entity that says, for every policy that you push out, that you are using taxpayers' dollars to fund,
right,
we must have an equity lens tied to it. So just like we have a Department of Defense and Department of Housing and Department of Transportation and Education, we should have a Department of Equity with a Secretary of Equity, that literally, with this department, you have representatives that sit in each of the other departments, so the Department of Transportation, to look, and they feed information. They come together with the Secretary of Equity to say, let's look at all these. How is it targeting the marginalized communities, whether that's along the lines of race, gender, religion, communication, sexual orientation, those persons that we know have these disparities? How, if we push this bill out, like this vaccine rollout, let's look at it with an equity lens. Is it going to be dispersed amongst all citizens equally? Or if we see racial health disparities exist with COVID-19, should we be doing an age adjusted along the lines of race, right? It may be that, yes, for white people, 65 and older is fine, but for Black people, since y'all are dying at younger ages and you have a shorter life expectancy, your grouping is 45 and older. Let's go, right? Those types of things from the foundation, not afterwards.
Right.
Now they can say, oh, look at, right now, again, we still only have 7% of Black people that are included in that fully vaccinated pool. But in 3 more months, they can clap hands and say, oh, we did a great job, because now Black people have finally caught up. We're 6 months into this. Right. And so don't clap for me if equity came because everyone else had already gotten. That's not equity.
Yeah, and I agree with you. And I like the way you stated how the Department of Equity should be. I mean, my initial reservation was I think about what a lot of corporations have, and the inclusion department is, the place to go to file a glossy report, and then maybe have a party and then say, wow, we've done great work. Right. And that's pretty much what happens in a lot. And it's usually one Black person, a Black woman, a Black man, they're in charge of it with no actual power, but they can say, listen, we got this department. So that was my only concern. I mean, it does have to be integrated into the leadership and into the thought process and into the policy on the front end, not on the, oh, we did this. You guys check off. I mean, which is usually how it goes down in institutions. So I agree with you in terms of how it should work.
Right, because it's not a DEI, as we typically. That's not how it looks in my brain. Literally, what I would expect from the Secretary of Equity is they come up with metrics for each other department to say, these are things that we're going to track from year to year to year. to see that if Department of Defense, they have $740 billion for their budget, right?
Yep.
What are you doing with that? And if we can look at certain metrics to see over the course of time, have you improved or not? And your budget will be shaped based on whether or not you're making movement in these areas. But that's the way that the public can have some accountability, or being able to track these departments. Do we know what's happening out of each of these departments? Is it public facing? Can we collectively say, hey, Department of Education, what are you doing for our children in a form that's digestible and how do you say, in real time being given back to the public?
Yeah.
They can say literally, again, this is what the metrics we're looking at, whether that's expulsion rates, and trying to investigate what leads to that with our Black and brown children, to see if this July versus next July, have we cut those numbers down? Have we poured resources into wherever we find the weakness of that system to be? That's the accountability that I want.
Yeah, that makes sense. All right, I want to focus a little bit and pivot a little bit to talk about the vaccine, because specifically with our community, although what you said is true, that there was this narrative that we wouldn't get it because we didn't want it. There is some resistance, and it's based upon the reasons you said earlier, the mistrust of the government and people in power, not believing that this vaccine is going to do what it says it's going to do, or that it's going to affect Black people differently. So I really want to go through some COVID-19 facts and myths, because I think it's important for people to hear from somebody like yourself, who is a doctor, who is on the ground, who has studied this, who has seen this, and you kind of just take us through it. So people dying from taking the vaccine, what are the numbers on that? Because people are saying, so there's some people that believe like, oh, you have a 1% chance of death and all that. And they say you have a 1% chance of death with COVID. So I'll take my chances. I've literally heard educated people with multiple degrees who are seemingly very smart people say this, believe it. What say you?
And it's unfortunate.
Sorry. Yeah.
It honestly is unfortunate, because there is greatness that comes out of social media. And then there's things like this that come out of social media, because I would honestly ask them, show me what data you're looking at. We're looking at the clinical trials, for instance, and even beyond that, Pfizer and Moderna, they all pooled their information. But what we know is that, for instance, when I'm in the operating room, I give out antibiotics for surgeries.
Yep.
For every 2,000 patients, one will have a reaction to penicillin, right? Penicillin allergy. What we saw with this vaccine, every million people, we had 11 people that had reactions. 11. Now, that's not...
So say that again. For every million?
It was 11.
Okay.
Now, that's not to say, especially for those 11 people, that's the world, right? But those 11 people, a majority of them actually had history of severe allergies. We know that some people, like me, I don't have allergies to anything. I can eat what I want. I can get bit by a bee, an ant. I don't have allergy. I don't have pollen, nothing like that. My sister has had an anaphylactic reaction. Anaphylaxis, meaning that she literally, her airway started to close when she was bit by a fire ant, right?
Right.
So, and people like my sister, who literally has to carry around an EpiPen in her pocket, in her pocketbook, and one in her car, just in case she ever comes across a fire ant that she cannot avoid, right? Out in the world. For those persons, then yes, if you've had severe reactions like that you have required having to go into the emergency room for someone to help you to breathe again because you have a severe peanut allergy or severe, I can understand the person saying, I'm nervous about it, right? But regardless, for all persons, I've handed out vaccines and participated in a few of the vaccination centers. We keep everyone there for at least 15 minutes, right? To just say, we just vaccinated you. We're just going to watch you. You don't leave until you feel that you are safe. But at least 15 minutes, you have to stay here, right? And that's what you're going to see with these vaccination stations. That's what we're doing. to build this confidence that we're just not vaccinating you and sending you off. Now, that being the case, when we're looking at risk benefit of getting a vaccine versus getting COVID-19, what we know is that there's not enough.
Before you get to that, have there been any confirmed deaths from the vaccine?
No.
I don't think so. That's important. Like, there have been this many confirmed deaths from the vaccine. Zero.
That's where the social media thing comes from. Like
Zero
I said,
compared to how many deaths we got with COVID-19 in America alone is
over 550,000
okay
in America alone.
So 550,000 deaths. So your chance of vaccine 0 to getting COVID-19, 550,000 deaths. Right. That's what we got, right? So go ahead. And that doesn't include getting people that survive that are long haulers, people that survive but still have to go to the hospital for months and be on a hill. So I'm
glad you brought up the long haulers, because that's an important.
Because I know 2 long haulers who are in great condition.
Right. What are their symptoms?
So one, just breathing issues, not being their full, their immune system is not all the way back. Right. Just breathing, they have trouble catching their breath still. That's pretty much their symptoms. But these are people that were athletes and they still are having trouble.
If your listeners are wanting to do some research, they can actually Google the Red Sox pitcher. I want to say his name was Eduardo Rodriguez. I think that was his name. You can also look at the incoming freshman quarterback for Georgia State, 18 years old. The pitcher, I think he was 27 years old. They can look at University of Pennsylvania, the athletes of that school, because what they were showing was these people literally had mild to asymptomatic COVID-19. They weren't in the hospital. They may have had loss of taste and smell. They may have had a little cough, a little fever. That's it, right? But when they did scans of the heart for the University of Pennsylvania, 15 to 30% of all athletes that had COVID-19 with those mild to barely any symptoms, 15% when they scanned them had inflammation around their heart. The pitcher for the Boston Red Sox.
So back up. Mm-hmm. So even when people that didn't have any symptoms, when they did MRI, was it MRI or what was it? MRI of their heart, they showed that 15% of them had an inflamed heart. Is that what you just said to me?
Right. And if you look at the Boston Red Sox pitcher, like I said, I think his name is Eduardo Rodriguez. He couldn't play for the season. And the last report I saw from him in September was that he was finally cleared to be able to walk because of the inflammation around his heart. The incoming freshman quarterback for Georgia State, he's now, he was 18. He's now recovering from inflammation around his heart, but he was also not able to start.
Wow.
And what we're seeing is that studies show 30% of all those who've recovered from COVID-19 have these long hauler symptoms of inflammation around the heart, of their brains their attention span is off.
I've heard that too.
Are they chronically tired? Are they having chronic pain issues now, like their extremities hurt, their lungs, they're short of breath? And the craziest thing is, because you'll hear a lot of people say, oh, I got COVID, and the only thing I lost was my taste and smell. That always confused me, because I'm like, you do realize that means that the virus literally
got to your brain,
infected your brain and caused your brain to not function right. And the question that I have is, what does that do to the incidence and development of Alzheimer's, possibly at an earlier age? So instead of you being 60, 70 years old when you start to become demented, that you may be 30, 40 years old. What does it do to the incidence of multiple sclerosis or Parkinson's disease? These things that we know if you have scarring or inflammation in those areas of the brain, will we see development of that? With these people who have inflammation around their heart, you're 18, 19 years old now, and you had to not play a sport because your heart had gone into shock at this point.
Right.
Due to the development of heart failure. Will we see you, instead of having heart failure when you're 60, 70 years old, will you be developing heart failure at 40, 50 years old? Will we need Will we have an increase in heart transplant requirements? Will you have AFib, A-flutter because the conduction, the way your heart beats, will it become abnormal at a younger age? There is so much that has potential because of that inflammatory process, that when people say, I don't know if I want to get this vaccine, I'll risk getting COVID because I might only get a loss of my taste and smell. I'm like, you just don't know.
Yeah. And like I said, I know somebody, like I just had this conversation with one of my fraternity brothers. He was a really smart guy and used to, he did IT in the healthcare industry. And his analysis was, well, you know, as long as everybody else gets it, I don't necessarily want to get it. And here's his reasoning. He started listing reasons and I started debunking them. But one of his reasons is something that I think a lot of people bring up, and I want to bring up with you. They say, oh, well, if I take it, I can still get it. So why would I take the vaccine and I can still get it anyway? What do you say to that?
So for one, if you look at every clinical trial, and that's not only for Pfizer and Moderna, but also Johnson & Johnson, and even with AstraZeneca now, who they're going through some things. But
yeah, I would tell people, yeah, let's just do the other ones. Go ahead.
The three that we have so far, but with those, what we see is that when we're talking about vaccines, what we're trying to concentrate on is we're trying to make your body have a defense on day one should you get infected. The vaccine isn't like an umbrella when you walk out in the rainstorm where it keeps all raindrops from you. No, right? If you're going out in COVID and someone coughs directly in your face because neither you're wearing a mask, COVID can still get within your body, right? But what we're hoping is that if you have a vaccine on day one, because antibodies are already circulating within your body, right? That if that one virus gets into your body, instead of it going from 1 and being able to multiply and becoming 10 and being able to multiply and becoming 1,000, being able to multiply and becoming 1,000,000 in your body before your immune system has had a chance to kick in and start producing these antibodies. If you have a vaccine, immediately, as soon as that COVID vaccine or COVID virus enters into your system, you may go from 1 to 100 viruses, but you won't get to that 1,000,000, to that surge of viral load, because it's immediately ready instead of it taking 2 or 3 days before you ramp up to mount this immune response. And some people may say, you know, well, that's only a difference of 2 and 3 days. 2 and 3 days in terms of COVID, it means the world. Because of the inflammatory process. If we can stop your viral load, if we can stop this virus from literally destroying cells, right, and causing this inflammatory process, we have a chance to save your life. And that's what we're seeing with all 3 vaccines, is that you see there's no severe COVID cases, meaning that even those that tested positive from COVID, they weren't testing positive because they were in the hospital on a ventilator. There's no people on a ventilator who's been vaccinated. There's no people who have died from COVID-19. Okay, that's been vaccinated. And those are the 2 key things that we are really trying to, prevent. And why people get into this debate of, oh, but I can still get COVID. Yeah, but you didn't die from it. Okay?
You didn't die. And the other part of it is,
oh my God.
Yeah. And then there's the collective thing that doesn't always work for people, but we can actually stop the spread. And what I told him is like, well, because he was like, well, if everybody else in this room takes the vaccine and I don't, then we'll be a herd immunity. I said, but if too many people think like you, we'll never get there.
And how selfish is that? The only persons that should ever say, well, if everybody else do it, then I don't have to do it, should be a child. Okay. And adults, we really have to start thinking about that, because this is when it's not time for you to be selfish. Yes, you can be selfish in ways because your life matters, but we have to think about the fact that right now, children are dying from this. We buried babies, and I do mean couple-week-old babies from COVID-19. We're exposing these children. When I said that we have long hauler symptoms, there's a study that literally showed that 33% of children in their study were long haulers. Okay.
Wow.
Think about the impact when these babies, these 5-year-olds, 10-year-olds are getting infected with COVID-19. Their bodies are still developing. Now, I was almost cussed again. Go ahead. You go cuss, woman, cuss. You can cuss. Because when I think about kids, I do get amped up because
get amped up. It's okay. Right. I like the passion.
Right, because adults, we have a responsibility to do our part to try to protect them, right? And so that person who is old enough to have a conversation with you shouldn't be thinking, oh, I'm gonna let everyone else around me get vaccinated so I'm protected. They can pass the virus on to a child, right?
Yeah.
You got to think about that. How do I reduce the likelihood? Because and the reason why, again, that, it is just so important is the long-term consequences of what this will have on someone's life. We don't know. And so for these children who are not right now, literally cannot be vaccinated, we're starting to enroll them in clinical trials, and we'll hopefully have some data on that by the end of summer, but we don't anticipate kids being able to be vaccinated until 2022, right?
Right.
So in this meantime,
below 16, you're saying?
Right.
Yeah.
I think 16 and older my niece is 16, and yes, but yeah, but when I'm talking about babies, I'm thinking about like the little
16 still baby to me, but that's just me.
Babies, but she is she teaches me a lot. She's very mature, but that being the case, though, is as adults, we have the responsibility to say, as their pancreas, these little fifth graders, their organs are literally still taking shape, right? Do we really want to not do our part to protect that?
Yeah. I mean, I think that's, they'll save that. That's what we got to think outside of ourselves.
So, your friend in particular, though, I'm not sure what their age is, but I will tell them
about my age.
Okay. Because for Black people, when we're talking about COVID deaths, a lot of times the narrative was that
I have somebody in a close family member that's my mama's age that it doesn't trust the government so speak to them too. Go.
Okay. Well, let me talk to them, because when we're talking about COVID deaths early on, there was this narrative that it's only old people and only sick people. And I was on Twitter every day saying, stop saying that, because it's not true. It's not true for Black people. Black people have higher death rates in every single age category. But the greatest disparity, meaning the difference in the number of white people versus Black people dying, isn't in the very, very old. We're 1.8 times more likely to die if you're 85 and older, right? Okay. The greatest disparity is actually in the younger groups. For instance, between the ages of 30 and 49, if you are Black, you are 6 times more likely to die from COVID-19 than if you're a white. Mm. That's what the black guy needs to understand. And especially Black men. In the first 6 months of 2020, Black men in particular lost 3 years of life expectancy.
Wow.
And if you think about it, then most deaths actually didn't happen in the first 6 months of 2020. It happened in the last 6 months of 2020, right? That's when we really started to have a lot of people dying. So Black men in totality, we may see that 2020 cost you all 5 years of life. And if your life expectancy was already 72, you're looking at telling Black men, don't expect to live out of your 60s.
Damn. Wow.
And that's why when I say I get amped up, I don't try to get amped up, but it's literally, I feel like we're screaming into the wind. And when I say there's been a lot of Black physicians out here screaming, saying, you guys, please listen, because we are seeing our people dying. We're seeing people coming into the emergency department. We're seeing the other side of it and saying that no. And we're also using our forward thinking to say, okay, I just now saw you. And yes, you left from the emergency department. And no, hopefully you won't die. But I see the way you're breathing and I see the way your heart is acting. And I'm thinking about you 10 years from now. And I'm thinking about seeing you in the ICU because your heart no longer functions. And now you need to be on a heart transplant list or other consequences that we can foresee. That's what we're screaming to. Like, don't take this lightly, because you are the very person that is more likely to die from this, and you don't have to.
Wow. So two questions, both very different though. First one about people that just don't trust the government. You and I before this, we did a poll that you mentioned about the ranking in terms of people that are less likely, the least likely to take the vaccine. I believe it was Republicans, then it was Black folks, and then I forgot who the next, was it Latinos?
Yeah,
it
was.
Yeah. So, I mean, it was Republicans first, which makes sense because, they had a president that said it was a made up virus. And of course, he still took the vaccine as soon as he can get it. And then, I think Black people, the reasons are all the reasons we dealt with racism in this country, the mistrust, the experimentation that's been done. I've had people tell me that, yes, I know it's been around the world and it's working, but they won't give us the same vaccines. I mean, how do we convince people that have so much mistrust built up, some of which is justified, some of which is not, but how do you speak specifically to the Black community about this when they say, I don't trust what they're doing. I don't trust these pharmaceutical companies. I don't trust them. And I don't, they came up with it so fast. I mean, this is what I hear people say all the time. Like, what do you say to people to try to convince them about things that have there is some grain of truth in those things, right?
It's a lot of truth. I mean, there's
right.
been medical injustice that's happened for generations that is still happening. I mean, we can talk about Tuskegee, right? And that's what a lot of people bring up. But honestly, I don't even think Tuskegee is the main thing that people are thinking about when they say, I don't trust the government. But if we do talk about Tuskegee, what we have to remember is that Tuskegee wasn't experimenting with a drug. Tuskegee was related to the fact they told Black men to come in. They wanted to test them and see if they had bad blood. But really what they wanted to see was, do you have syphilis? And when they found out those men did have syphilis, they decided to not give them medicines. So this happened from 1932 to 1972. We knew that the cure for syphilis was in 1947 to be penicillin. So for 30 more years, the U.S. Public Health Service said, we just want to see what does syphilis do to the body? Yeah, we could treat you, but we're not going to. That was Tuskegee. It was the withholding of medicines. And because of that, 28 men died. Another 100 died of complications related to syphilis. They allowed 40 wives, at least 40, because we know these were young men too, so they may not have been married. They may have had girlfriends, but 40 wives contracted syphilis, and 19 children that we know of was born with congenital syphilis, knowing full well we had a cure for it. That was Tuskegee. And what I don't want to happen is this to be another Tuskegee part 2 of where, again, the United States government we've studied why is it that Black and brown people are dying at higher rates. And when we have an intervention that could potentially save their lives, where Black people are not given that intervention at the same rate, that's what I don't want to happen, because that will be Tuskegee part 2. But for the for the people that have distrust of the government, what I always say is sit back and look and see who jumped over the line to get vaccinated. Yep. And you did have the very people that were like, oh, this is a hoax and this is nothing more than a flu. But Trump was right there first in line, and his wife. We had Mitch McConnell and his wife. We had Lindsey Graham, Marco Rubio, who is young. And, we had all these young people of power and influence and money jumping over the line before even old Black people even had a chance to get vaccinated. Yep. That's what you got to sit back and look at to say, if it really was killing people, would they be clawing their ways up on the stage to say, oh yeah, videotape me so I can say this is the reason why I need to get the vaccine first? Because Marco Rubio, you can wait your turn in line. But that's what they do. And so, but when it comes down to that, I think we also have to, the big push for a lot of us Black doctors was, we said, we know we're in the phase 1A. We're going to be the first groups of people to do it. So videotape us. And literally I put on my YouTube channel every day. I would just go and just say, this is how I'm feeling, answer any questions that people had posted about it, and talk about it. When my 81-year-old grandmother got vaccinated, she sent me a video. I put hers up there. When my mother got vaccinated, when my sisters got vaccinated, put their videos up there, because I think if we show these truth and transparency of we're people just like you, here it is, this is what it did to our bodies. Take it for what it is, instead of reading something on social media that you don't know if someone created that story, whatever they wanted to say. Ask people who did it.
Yeah. And I understand when people talk about not trusting pharmaceutical companies, because another one of the lines often repeated was, well, they're pharmaceutical companies, and no, they're not to be trusted. However, back to your earlier point, the reason why they came up with the vaccine so quickly is really easy. I mean, the economy was being affected. It was affecting a lot of people, and it was affecting money. So they were going to do anything they could, and they put all of their energy, time, and resources. That's why it came up so quickly. That's the answer.
And it's even beyond that. See, this is the problem too. Trump really wanted to make this political because he needed to have something to try to save his presidency. And that's what people got to remember. So this whole even term of warp speed, what we know is that mRNA vaccines have been in use since 2003. You can look up mRNA vaccines and targeted therapy for cancer treatments, because the reason why it can be used for melanomas in different types of cancer is if there's a cell in your body that we want to specifically target, if there's a protein on the outside of that cell, if that cancer, for lack of a better analogy that people can kind of envision, if a woman has a breast cancer, and we know that breast cancer, the cell looks slightly different than a normal breast cell, right? If we can train your body to recognize that abnormal cell, then instead of giving you chemotherapy that makes your whole body sick, then maybe we can give you an agent that tells your body, attack that one breast cell, that cancer cell that looks different. That's what we want you to remove. So that's what they've been using for melanoma with mRNA vaccines. And with the coronavirus and with viruses in general, they started to look at use of mRNA vaccines for viruses with Ebola, with the SARS-CoV-1. SARS-CoV-2 is COVID-19. SARS-CoV-1 was back in 2003, right? And that was mainly in the Asian continent. I want to say, unfortunately, about 800 people passed away or so. Back in 2003. So but it got maintained. It didn't get to a point where it became a pandemic where millions of people died and everybody got it. Right. It wasn't as contagious as what we're seeing with SARS-CoV-2. But with that, there was this idea, and you can look at during the Obama administration, they talked about we need to prepare ourselves for a potential pandemic. So I think this is a really, really important point. They started preparing this technology a while ago. It wasn't that it just came out. It came out of nowhere. I mean, they definitely sharpened their pencils and got down to it. But this has been going on for a long time. So when people say they came out of nowhere, that's actually not true. They've been doing it since 2003. I'm glad you said that, because I didn't know that either. That's very important, I think, for the listeners to understand. Right, and it's one of these things. If Trump couldn't say, "Oh yeah, the Obama administration said we needed to prepare for a potential pandemic if one were to occur because of what happened with SARS-CoV-1," he can't say that because he can't give Obama any credit for even just smiling. Right. So when this virus was detected, immediately what happened was they got a sample from someone who was infected with with COVID. They determined what's the genetic sequence. So, Amari, when they say like, "You're not the father," that's because they look at someone's genetic sequence, right? Right. You can do the same thing with this virus to say, what is the coding for this virus? And if I can take that now and take a piece of the virus. So if you're looking at, for lack of a better word, the mRNA vaccine basically just codes for the virus's coat. It's not the whole virus. It literally just trains your body to recognize if you see this coat, then you're supposed to attack it. Right. So what Moderna and what Pfizer and with all the other groups did, they said, well, this is the coding for this virus's coat. Here, put this and create this into this mRNA, because now you know the genetic sequence. So you literally can, almost like a typewriter, can type out the same message. You can create that coat coding over and over again to create this vaccine. And that was it. Yeah. It's not only that made it go quickly. It's also the process of, typically for a drug, what you have to do is first do all the studies. And then once you prove it, you then create and make all the drug. Now, this is the difference. Because so many people were dying so fast, what the United States, and not only the United States, but the entire globe said was, instead of us waiting for all the clinical trials to be done, and then you make all the drugs and vaccines that are needed to vaccinate the entire globe, we're going to do the same thing at the same time. We are going to trust and just throw money into the fact that this vaccine may possibly work. If it doesn't work, wash your hands, and we'll just have to toss that on the side. And it's going to be a lot of money lost, but it's worth the risk that if you go through these clinical trials and this vaccine actually does work, then on day one, we want to be ready with millions of doses of this vaccine readily available to put in the arms of people so we can keep them alive. So that's why it went from being year-long processes to it running in parallel to each other, and we can cut that time down significantly.
Right. But we have enough. Here's the thing. People tell me they're going to wait. You've already waited. We got enough data to show that it's safe. Like you don't have to wait. If you're listening to us right now, the data's out. Millions and millions have already taken it. Not only is it safe, it's the best thing you can do for your family, and we have all the data to back it up from all around the world. So you don't have to wait anymore. Another thing I would add, I would actually ask you. People, I've heard this, so I gotta just repeat these things that I don't understand, but people say it, so I want to just repeat it. How do we know that we're getting the right vaccines? I've heard people say that, they're going to give different vaccines to different areas. How can we know that we're getting the right vaccine? I've heard it a lot.
Right. So a couple of different, one thing too, when we talk about millions of people right now in the United States, this is March 24th. We've had over 128 million doses of vaccines have gone into the arms of people. 128 million doses. So that's just in the United States alone. That's not even around the world. So that just tells you how many people have actually,
and 0 deaths from the vaccine. Go ahead.
Just want to make that.
We have to keep saying that. Like, yes.
Right, for sure. Now, when we're saying this, go ahead.
No, go ahead.
Okay. One thing I can say, when we're saying this whole idea of how do I know I'm getting the right one and how do I trust, quote unquote, the man, the way I really approach this type of skepticism is to say this: what the government knows is that if it does not get this pandemic under control, right, that the health and wealth of our nation is literally tied to Black and brown people actually being healthy this time. Think about it. When Black and brown people in this pandemic early on started to die, when we could not go to work, the entire nation had to shut down. Black people only make up 13% of the population. Hispanic Americans only make up 17% of the population. So collectively, we're looking at 30% of the United States. And yet, when we were the ones to get sick, we weren't going to schools anymore. We weren't going, all the stores had to close. Our nation went into a financial spiral. The federal government literally had to, the reserves had to dump trillions of dollars into the system to keep our nation afloat. That's how important the economic lift that Black and brown people do. So trust me, on this one, the government, look, on anything else, I'm not going to say that, but
you can go to, there are places you can go to. Like if you shop at Kroger's, why wouldn't you get a vaccine at Kroger? I tell people, well, are you going to eat or do you eat at Kroger's? Do you go to Walgreens? Like, do you not get stuff there? Do you not trust anything you get there? You go to these places, you can get the vaccine. I'm actually with you for the reasoning. I want to shift to one other point before we get ready to close. How do we approach this with some optimism too? Like we're in this with the optimistic point of view. We've lived in a lot of fear and some reasonable fear, but some of it, I think people have also been afraid to do things they need to be able to do. Like at some point, our kids can't get vaccinated, but I think kids are going to eventually have to go back to school. Like at some point, we're going to have to figure out how to move forward and balance our lives out. Like, how do you advise people just to move out of the fear and just move forward here? As I think that's a big underlying condition. A lot of us have been traumatized. Period. We were already traumatized, and this has been a even more challenging year. Like, how do you advise people moving forward to pivot back to normal, or what the next normal even looks like?
Right. Well, what I hope the next normal looks like is more sense of community. If there's a silver lining in 2020, I think it was that we did lean on each other for the emotional support, not only during the protests and thinking of, George Floyd and Breonna Taylor and Ahmed, but it was also in the grief of losing family members. At this point, every Black person knows someone who's died from COVID-19 or been severely impacted by COVID-19, right? 1 in every 3 at least definitely know. And then if not, somebody who knows of somebody who did, right? And I think the thing that's going to get us through and the hope of it all is that we did survive it. we will never be the same ever in our nation. I hope our nation never goes back to what it was, because there was a lot of stuff we need to fix. But as a group, I think it just is another notch on the belt of Black people to say we survived that too.
Yeah.
We survived slavery. We survived, Jim Crow. We survived the pandemic. We've survived all this stuff. And how do we want this thing to shape us? What did it expose as far as the flaws within our society that negatively impact our life? And how are we going to hold elected officials accountable for that? And not only hold them accountable, how are we going to run for politics in order to fix it ourselves? I think that's what we're going to see. And we have seen a big push in us being.
Are you going to run for something? You would be great.
Listen, I am eventually. I just have to figure out
Wonderful.
when I can actually do that. But yeah, but it is important because we know health is political, education is political. All this stuff ties back into what policy said it's okay to treat people this way versus that way. So
yeah, Dr. Ebony Jade Hilton, Goodstock Consulting, future senator of some state somewhere. It was great having you on.
Thank you.